It's really a privilege to just be here with all of you. I'm just really grateful to have the opportunity to share some of the options that are available, and also to just be a resource. The most important thing is it may not be anything I may say today. Oop, that's not going to be a good thing, talking with my hands here and hitting the microphone, but to be a resource. So if you take my information, which I'll make sure everyone has before you leave, and you have any questions, concerns, my son may go to this place in Timbuktu, just give me a call and ask me, or shoot me a text, or whatever you prefer. It's my favorite thing, is to just be a resource. So that's why I'm here. So 16 years ago, I started Awakenings Treatment Center, and I'm still sort of in shock that we're still going strong, but we are. And what happened in my family was that, several things happened, but for our purposes today, when I had our second daughter, who's now 19 and just celebrated 2 years of sobriety, she was born with pediatric epilepsy. And the neurologist who was taking great care of her said, so we need to get her on phenobarbital right away. And my husband and I, who met in a 12-step program and so on and so forth, said, well, he didn't know what phenobarb was, but I said, oh, that won't be happening. And the doctor said, well, if you don't put your 16-month-old baby on phenobarbital, it could kill her. And I said, I just felt like there's got to be another option. And I explained, the genetics are not going to be good if our baby's put on a habit-forming substance at 16 months. And there was really no further drama. I stumbled over this thing called neurofeedback. And this was in my personal life. I was a licensed psychologist at that point for many, many years, and I had never heard the term neurofeedback. As the universe would have it, a gentleman that's one of the primary researchers in neurotherapy was right down the street from where we are. We're just slightly inland in Agora Hills, California. He was in Malibu. Needless to say, me and my 16-month-old were down there getting her neurofeedback. The scientific term is EEG biofeedback. And after 17 sessions, she's never had another seizure. And they all happened before her second birthday. She's now 19. There's been many other adventures since. That's been true for both. My older child, who is 20, has 5 years of recovery at this point, but my little one has just celebrated 2 years. And through the grace of God and a bunch of other interventions, I think. So neurofeedback radically changed my life, because as I read the academic literature, the literature was talking about addiction treatment and mood disorders, even thought disorders. And I just thought, how do I not know about this? It is profoundly cost effective. If it weren't, I wouldn't have been able to do it. And it completely changed the trajectory of my whole career. So that was 17 or 18 years ago. And I was in private practice. I had worked in a bunch of corporate environments. And I just thought, I can't do this work anymore without incorporating this very simple, very cost-effective treatment modality that dramatically grounds the nervous system so that people can hear what's said in a meeting, so that people are not necessarily vibrating up here anymore and can learn the DBT skills training or whatever else we're putting on them in a regular treatment center. So I decided to make the neurosciences the core of what we do at Awakenings. And everyone that cares about me, my colleagues, my loved ones, said, you're going to go bankrupt, you're going to be living under a bridge. And I said, well, you might be right, but we'll see. And we are 16 years later. The other piece was that I kept seeing the profound recidivism. I had worked in just the nicest of the Malibu treatment centers and so on and so forth. And I was horrified that not only would they continue to wing in and out, but that somehow we were blaming them for our failure to provide effective treatment. So somehow the client was to blame. If someone doesn't get well from chemo, we don't blame them for the chemo not working. We know that the chemo failed. But somehow there's this shame-based underpinning and stigma, of course, and so on and so forth. And that just was feeling awful to me. And I wasn't even sure how I was going to continue in the field, because I wasn't going to do this shame-based dance with people for whom I could tell had very sincerely dedicated themselves to trying to be well in their mental health challenges, as well as the overlap with their addictive disorders, as well as eating disorders, chronic pain, fill in the blank. So our mission at Awakenings is that we transform complex mental health challenges with science and compassion. These are not mutually exclusive things. People often come and say, oh, I thought this was a science facility. I thought it was going to feel like a hospital. It feels like a spa. Are you sure you're doing real treatment here? I said, it doesn't have to feel bad. It doesn't have to smell bad. It doesn't have to look bad, but we can do both. So we do both. So what the heck do we do? This is just Shari Corbitt's recipe. It's not, I don't have the corner on the only way to do treatment. I do have very strong feelings that this is what I'm going to share with you today is the most comprehensive way to support the client that's struggling, as well as the family. And so, I forgot to say when I began, please don't necessarily wait until I'm done to ask a question. Just interrupt me, because I'd be delighted to just kind of have a back and forth conversation if that's okay with you. And if you want to wait till I'm done, feel free to do that as well. So one of the first things that our loved ones with mental health issues and psychosis specific to their marijuana usage is they really benefit from understanding what's going on. So I don't know if any of you have had loved ones who have gotten a really detailed grounding in the neuroscience of cannabis-induced psychosis, but it really helps if they have a sense of the science in a digestible way, in English, of course, but it really makes a difference, and it can inform our ability to do motivational interviewing. Does everyone have a sense of what MI is? You've all been around the block. This is obviously not your first rodeo, or you wouldn't be sitting here. So when we can utilize education in simple, clear terms to inform motivational interviewing, you can start getting people interested, because it's not about we have to treat this horrible thing that you have and that you've tortured your family with, although you probably have tortured your family. But we're going to bring an educational component to this, and we're going to provide an academic environment, which is a slightly different approach. Every treatment center under the sun is doing MI, but I believe we sort of approach it with a very significant degree of respect and consideration that I think lends itself to an easier engagement. So any question about the psychoeducation and the neuroscience about that? I don't want to do too deep a dive, so no questions about that. Basically, what we're doing when we're providing the neuroscientific education is really honoring that your drug of choice was chosen by your brain, by your central nervous system. I know you think you picked your drug of choice, but if you had a different nervous system, it wouldn't have been marijuana. It would have been cocaine. And many clients say, well, I use it all, so what does that say about me? And what it says is that you've been using for a while. That's all it says. There's nothing, you're not exempted from the rest of the conversation because you eventually got to stimulants. I said, my best guess would be that you were maybe trying to hold on to your employment or your academia. And so you knew you had to wake up in the morning. So you wound up in the land of stimulants as well as marijuana or whatever other drugs of choice they may be using. And so by talking about and honoring, your neurology made your drug of choice for you. So let's address why it did that. Because no one woke up one morning and said, I feel so good in my skin, I think I'll start smoking all day, every day. No one ever said that. Their neurology was driving them. And by the way, blaming parents isn't part of the recipe either. You'll be relieved to know, as I was. Yes? Oh, am I not being loud enough? Oh, got it. I was going to say that will be the first. Oh, you're supposed to use the microphone. Got it.
I'm supposed
Got
to use
it.
the microphone.
A little slow
We
on
can
the
hear
draw.
you great. I feel since you welcomed questions,
Yes.
I feel compelled to share this with you.
Please do.
Just because so I'm a counselor. I'm a therapist, master's level at trauma. But I'm here as a mother. My son had cannabis induced psychosis, has relapsed, and is in it again after almost 2 years sober. But as a therapist, we went to a treatment center and we had a family therapist work with us who I was not trained in motivational interviewing. You know, Carol Rogers, but not this. But I thought to myself, oh my God, she's amazing. What is she using? Our son spent a 50-minute family session asking to come home over and over and over early in treatment. And we were like, oh my God. And she was able to say, wow, you're really persistent. That's amazing, Ben.
Yeah.
Like you really get dialed in and you have it.
Yeah.
And I was like, what is she using with us? And I just bought the book, Motivational Interviewing, and it's amazing.
It is.
It's like active listening.
It is.
Right? And really deeply listening. So I just want to say yes to motivational interviewing.
And thank you so much for bringing up particularly the last piece of what you said, because it dovetails beautifully with the last speaker that you just heard and the craft model. And so it's just a very respectful, kind, compassionate way to be with our loved ones when we may not be feeling the ultimate of kind or compassionate. And so it's really important. And I just want to say for craft as well, many of our families that come to Awakenings lean into the craft model to just tremendous effect. So I'm excited. So thank you for bringing that up. Yeah, so we do the psychoeducation as part of that. Now, I say our children because my older child, who's 20, 5 years ago, became clean and sober, but not before they became profoundly psychotic. And that was why when I originally heard that there's an organization that's supporting families, the very first thing I did when I got the email was I burst into tears, because I thought that I thought I had irreparably harmed my child, because although I'm in long-term recovery, my husband's in long-term recovery, it just wasn't good enough. We had a sober household. It wasn't good enough. And the terror and the fear that we lived with for a period of time was debilitating. It was just absolutely debilitating. And so what we were seeing over and over was the degree of isolation and the social anxiety, the isolation and the social anxiety, and more isolation and more, the more they isolated, the more they became socially phobic, really. And my older one is on the spectrum. They could spend their whole afternoon with you. You would never know it, but that's partly to their detriment, because they can fly under the radar. They don't ever rock the boat. If you ask them to do something, they'll go do it. They're very compliant. That's a tricky person to work with, someone that's compliant, because they're very busy getting an A in treatment, but actually not really changing anything. And so when the psychosis became a part of our life, I really thought that their life was over, and primarily because their world had become so small. And that was when, and like many of us, and correct me if any of you feel that this is incorrect, my husband and I could not have been on more different pages. And I think that's a challenge that so many of us live with. And acknowledging that and honoring that our spouse is in a different place is so difficult, because we really believe that what we want to do is the correct thing. And I didn't have an ounce of enabling in my body. In fact, I kind of felt mean-spirited, and not because I'm mean-spirited, but because I knew it was the only thing that was going to work, was to learn that I was going to have to manage my own terror and not want them to get better so that I could feel better. Because that's what we're doing, right? When we're enabling, you need to get better so that I can feel better. And we put a lot of, Christmas tree ornaments on that, but that's what it really comes down to. If Elliot, my older child, gets better, I will be able to breathe. And I really didn't want to acknowledge that, but that's where I was. So I was the mean one. I was the baddie. And my husband was, his lovely, enabling, soft, kind-hearted self, really not understanding that if we had stayed down that path, Elliot was going to be dead at some point in the near future. And so we had to do a lot of work on that. And John just so kindly mentioned to me, if you don't mind me saying, that I had to do the work on myself before. And I couldn't agree more. And I said to my husband, I said, honey, this is going to be all about us. We are going to have to get really serious and do some very painful, difficult work, because this really isn't about Elliot. Elliot is doing what they need to do to be comfortable in the world. Granted, it's not going to serve them on a higher level, or in life in general. And granted, we do need to address that, but we're going to have to do some very, very painful inner work. Because, my husband and I were very fortunate. We walked into treatment individually. We didn't know each other, and we got well. With therapy and trauma work and all of that critical work. But we didn't experience psychosis. Neither one of us has psychosis in our family. However, my husband was one of 5, and all of his siblings are dead from the disease of addiction. So he had the knowledge, he had the inner emotional and intellectual knowledge that we had to take this very seriously, but he is who he is. And so that's one of the biggest things we had to do in terms of working on ourselves to get Elliot out of their social isolation. Now, as I said, they're on the spectrum. So the story got trickier, because when I would say, they're isolating, we need to get them out, fortunately, their very sophisticated treatment team said, sometimes they're isolating, but sometimes they're decompressing, because they need to do that as an autistic individual. So a lot of the work I do with families in terms of, more national work, as well as local to where we are, is helping parents navigate the middle path between what is isolation and what is decompression, a good, healthy decompression for individuals who have autism, regardless of where they are on the spectrum or how impaired they may be. And this is what we do at Awakenings as well. So we have a very specific cohort of clients who have all experience specifically cannabis-induced psychosis, or they have another psychotic disorder, but they all program together to address the social isolation and the intense, it may not have become a phobia for some, but at the very least, very significant social anxiety about getting out in the world. And so they program together so that they are, just sort of feeling, coming back to, I'm really not alone, even though I feel alone a lot. So what the heck do we actually do? What are these neuroscientific interventions? We do 3 different ones. One I already mentioned, EEG biofeedback, which in the vernacular is neurofeedback or neurotherapy. Again, we were introduced to it for our younger daughter. And it is the core component of what we do. It is for someone that's agitated and anxious, and in that spectrum of their neurology, it's very grounding. Of course, a lot of our folks are more vegetative, are more, some I would say in the catatonia area. So for them, the neurotherapy upregulates them. And so wherever someone's coming from, it's going to address their neurophysiology, which is why I love it so much, because it's the ultimate in individualized treatment. Hasn't every treatment center you've ever brought your loved one to said, we do individualized treatment, right? Really? Really? I want to hear about it. I want you to tell me how this is going to be individualized, because it's okay if it's not, but don't start our therapeutic relationship in a disingenuous way. Do not do that. Tell me we have a cookie cutter program and we believe it works for the majority of people, but I've never seen that in any marketing materials. We have a cookie cutter program. Of course not, right? Because we're the best and we're special. The best at what? Who are you the best for? So we're very clear at what we do. If you have had a bit too much to drink and you got a DUI, Awakenings is not for you. That's not who we treat. If you've been in and out on 51, in California, they're called 5150s, out of holds in hospitals, and you are having delusional symptoms, the whole range of positive and negative symptoms, and anxiety and depression, we are, that's what we do. That is what we are obsessively focused on, to I think, good effect. And so neurofeedback is going to upregulate or downregulate depending on what that person needs. Now, I'm grossly oversimplifying it. It's far, far more complicated than that. It's not just about caffeine or, or the opposite. It is a deeply complex brain retraining akin to this. Did any of you think you taught your child how to ride a bike when they were little? We're at the end of the driveway, we've just taken their training wheels off and we're clapping. And we really kind of think we taught our child how to ride a bike, but that's not what happened. Our child's neurophysiology learned how to kinesthetically deal with gravity. We weren't thinking that when we were at the end of the driveway clapping, but that's what happened. And in the same regard, that is what neurotherapy is. Neurotherapy can retrain our brain in a sustainable, cumulative, permanent manner. How many treatment offerings will tell you it's cumulative, sustainable, i.e. permanent? Not a lot of treatments can say that. When you take a very effective medication, that med where you think, okay, we finally found the right medication. If you take the medication away, you lose the benefit, right? With the exception of antibiotics. Hopefully you do your 10 days of whatever, and whatever was going on is no longer going on. But with all of our other medications, you remove the medication and you remove the benefit. That is not true with all of the neurotherapies. And again, I won't overcomplicate it. I'll just sort of quickly discuss the 3 different ones that we do. There are also other ones available in the world. And not only are they cumulative and permanent, they are cost effective. And I am obsessed with the financial wellness of our families because most of us, myself included, have bankrupted ourselves trying to help our children. And so one of the other components that we're very concerned about for our families at Awakenings is their financial wellness. We don't want you to plan for your child to be here for 1 or 2 or 3 months. It's not about Awakenings. It's about where is your child going to be 12 months from now, and is that financially sustainable? So that's why the individualized nature of the treatment, the cost-effective aspect of it, all of these things are sort of woven together in a way that I think is the ultimately supportive for families. Now, that having been said, the neurotherapies also treat the various symptoms of psychosis. Most effectively, the positive symptoms. So similar to antipsychotics, the neurotherapies, unless you can get the interventions for a very long period of time, then they do begin to resolve the negative. You all know what I'm talking about with positive and negative symptoms, right? But the initial pieces that family members and treatment providers notice is that the positive symptoms of psychosis start to soften. And so the agitation, the hallucinations become less compelling. I'm still thinking that thought, I'm still seeing that thing, but it's just not as engaging to me as it was 2 weeks ago. Or parents will often call me and say, "What did you do to my child? He's sleeping now," because we're an outpatient program. We have housing for out-of-towners, but they'll say, "My son hasn't slept in years." And I'll say, "Well, we can't take any credit for that. I'd love to take the credit for it, but we can't. That was the neurotherapy." And they say, "Oh, is that weird room with all the computers in it?" And I say, "Yeah." Yes?
Wait, there's one here first.
Oh, great.
My daughter's on her 3rd known psychotic episode.
Okay.
And she's recently been prescribed olanzapine, but she's not started it yet.
Okay.
So would your intervention go side by side with medication like that?
Yes, and we'll be talking about that. Most of our clients, actually all of our clients, are on one antipsychotic or another or multiple. The only class of medication that is contraindicated with the neurotherapies are the benzodiazepines. And we are an abstinence-based facility, I should say that, meaning that we don't allow opiates, stimulants, or benzos. Did I say that right? Opiates, stimulants, or benzos, for a variety of reasons. But the benzos are the only medication that interfere. And when I say they're contraindicated, nothing bad is going to happen. The client just isn't going to get the effectiveness of the neuro. And the research has shifted over the years. And by the way, this is nothing new. People think, oh, is this some weird Southern California thing? Is something going to get waved over my kid's head? This has been around since 1951. Really? 1951. And I didn't know about it. 16 years licensed psychologist. I had never heard the term. I think I went to like a CEU on ADHD once, because this is a frontline FDA approved treatment for ADHD and ADD. But I hope I answered your question.
Thank you.
Yes.
You got a follow on?
It was the same.
It was the same.
Okay.
Okay.
If we have another one.
Okay.
Is this, and I could ask Beth too, is this related to EMDR?
No.
Okay.
No, not at all. No, this is I'm going to tell you all a website that you can just jot down or look up. And by the way, I can wind up sounding like an infomercial. I have zero financial relationship. It's just the vendor we happen to use. It's the vendor that helped my daughter. It's called brainpaint.com. It's not a talk therapy.
Is this FDA approved for psychosis?
Yes, it is.
Bipolar?
Yes, it is. We don't do anything that isn't FDA approved, and with mountains and mountains of replicated research. Thank you for asking that, because that's super important that people know that. Did someone else have a question? No? Okay. All right.
What was the relationship with Brain Paint? Help me with that.
Oh, Brain Paint is the name of the vendor that we utilize for neurofeedback. So if you look that up, there's a side for clinicians and a side for families and clients. And if you look that up, you can see a video. It essentially is, the protocols are derived by a very extensive symptom-based evaluation. With other vendors, the client needs to get an EEG to identify what the most helpful neurofeedback for them will be. The good news is that there's even research, multiple research projects, on what is more effective for psychosis and addictive disorders, the EEG-driven protocols or the symptom-based evaluation. And the good news is, for addictive disorders and thought disorders, the symptom-based evaluation is just slightly superior. It's not statistically significant, but the way that we do it is more cost-effective because you don't have to go get an EEG. So it's good. It's good. Yes. Thank you again for the question about being FDA approved. Physical activity. How many of our loved ones who are dealing with this are physically active? Not so much. Does anyone in here have a loved one that's consistently daily physically active while they're psychosis? You do.
He was able to maintain.
He was.
surprisingly through
He was.
Psychosis. In the beginning, there was maybe a 2-week time period early on in psychosis. Where
Right.
He thought.
Amy.
Amy, hang on.
Yeah. I'll wait.
Okay.
I'm Amy.
Hi.
Yeah, my name's Beth.
It's okay.
So early on, when he went into psychosis, he actually had some insight,
Mm-hmm.
and he had always been very ritualistic with the gym,
Uh-huh.
and he continued to go, and maybe it was further than 2 weeks in, maybe 2 months in.
Uh-huh.
He started to struggle going to the gym because he thought people could hear his thoughts.
Yeah.
And he actually termed it thought broadcasting.
Yeah.
He knew the right term.
Oh, he
And
knew
so
all
that
the
was
things.
the only
Yeah.
time that he was deterred. And somehow he was able to talk himself out of that. And instead he transferred it to that he could read other people's minds. So it was like he went to the gym because he thought he could, you know, it was a superpower.
Yeah.
But he maintained the ability to go to the gym and sit in the infrared sauna during his entire psychotic episode,
That is
which was
remarkable.
untreated for like 9 months. And so we think that that actually kept him
Yeah.
in a better
Yeah.
state.
I couldn't
Yeah.
agree with you more.
Yeah.
And that is remarkable.
Yeah. I don't know how he did it.
I don't know how he did it either. It's highly unusual and wonderful. There's another question over here.
Okay. Sure. Okay.
Thank you. So we're neighbors. I'm down in Del Mar.
Oh, wow.
My son, who has been affected with cannabis-induced psychosis for over 5 years, in and out of homelessness,
Yeah.
was treated once successfully for about 9 months, then went back to use and quit antibiotic, or excuse me, the Invega.
Okay.
So long-acting.
Okay.
So he's super active because he's homeless.
Yeah.
And the way he supports his habit is to deliver Uber Eats.
Okay.
And he only needs to make like $10 a day, right?
Okay.
for Weed. And then you can stand in line or, you know, find
Yeah.
leftover food.
Yeah.
So he supports himself rather well right now.
Yeah.
Um,
Yeah.
But the way I was able to get him into treatment for a for that short amount of time, it was a while ago, so I know thoughts have changed on these things, but it was the TMS
Yeah.
and vagus nerve.
Yeah.
And the doctor that provided it for us, they had a great relationship.
Wow.
And then we went on to something else that was injectable, that was a little more experimental, that didn't work out, which gave him the courage to go ahead and say yes to the long-acting
Yes.
injectable. So it's unfortunate right now we're 2 years away, you know, after that,
Okay.
and he's in a really bad place. But this might be a really good
Yeah.
follow-up.
Was he at Crown View?
He was not.
Okay.
No, he was not. He was at Mission for Michael
Oh, okay.
for at least 4 days.
Got it. Because they do
Twice.
all the things you just mentioned, but you just in a nutshell
Yeah.
summarize so beautifully what I'm wasting all your time talking. You said it so beautifully, which was he had a wonderful relationship with the doctor. He got TMS, and he eventually, when he felt comfortable enough, got long-acting antipsychotic. That's the whole thing right there. Lots of bells and whistles. This is all bells and whistles.
Right.
You just summarized it beautifully. And one thing that does relate to this issue of, and I actually didn't think about this when I've talked to families, is that many of us have loved ones who, in the midst of their psychosis, we might not call it physical activity to improve self-esteem and confidence. However, when they get deeper and deeper into that psychotic place, there's a compulsion to walk. So, you know, in the part of another conversation. We'll talk about that afterwards. But so it's why it's not at all uncommon to see someone walking from La Jolla to Oceanside, because there's a similar compulsion to undress, to get one's clothes off. So this gets very complicated and quickly gets intersected with the legal system.
Right. And
But
we've
the
been there too.
compulsion to walk and the compulsion to disrobe are a very common denominator, actually. So I really appreciate you mentioning that.
Yeah, no,
Because of course, what I'm talking about is a little different. So I'm sorry, go ahead. As part of our facility, we actually have I consider it our sort of like our crown jewel. We have a 2,000 square foot gym in our facility, because, you know, a lot of treatment centers say, oh, we provide physical activity, and then they bus them to a regular gym with people who have no idea what's going on for them, and and they say, go work out. Well, they're smoking in the parking lot. You know, we know this, right? So our gym is a fully outfitted, beautiful gym. And the gentleman that does the physical training didn't get a weekend certification in athletic training. He got the real deal, the 2.5-year training. And our clients adore him. He works with them. He tailors their activity as a part of their master treatment plan. So if they are someone who's sort of vibrating up here and really agitated and really uncomfortable, he's not going to put them on the treadmill where he's going to replicate a panic attack. He's going to teach them how to safely and slowly do much more grounding activities. We do a shocking amount of, and I'm not kidding, powerlifting in our facility. And the clients will come up to my office because I'm on a floor above, and they'll say, "Hey, Corbitt, I'm winning the bench press competition." Now, this is a good thing. I mean, half the time I'm like, "Don't cry, Shari, don't cry, don't cry." Someone who thought that the CIA was after him that morning and still is pretty convinced, or for the last 6 months, is also engaged with his or her peers in an athletic activity. And we have everyone's names and the weight they're lifting on the board. And so the gentleman that does that is actually one of our most beloved staff members. Typically, I'll say if the clients love you, you're doing something wrong. But in this case, he's one of our most beloved staff members. Oh, yes, I'm sorry, John.
I'll add to what you just said. I think also gyms can be overstimulating to someone in psychosis.
Exactly.
It's just I found that
Too much.
with our son.
Yeah.
We go to the gym and he like 15, 20 minutes was all he wanted. He did a lot of
Yeah.
walking around,
Yeah.
shooting the hoops for 2 minutes.
Yeah.
One and then out.
Yeah.
Okay. Amy introduced me the idea of IR sauna, and our son still does that.
Uh-huh.
He's 28 months sober. He's on clozapine. He's bipolar schizoaffective.
Yeah.
He's doing TMS now. His 3rd week of that. And I'd like to get your input on IR sauna and the benefits and TMS benefits, if I can.
Okay. So I'm not an expert in TMS. I do know that it's now indicated for, there's so many psychotic disorders, and it is indicated for several of them because cannabis-induced psychosis is still trying to find its way into the ICD-10 codes. It's akin to this. I don't know if you guys are okay. I always do better with analogies. So before there was something called binge eating disorder, I'm going to give you a completely different example. Before there was something called binge eating disorder, because it didn't exist, even though it's the #1 eating disorder in the United States, you couldn't have a medication that was indicated for it. Or insurance carriers wouldn't cover it because, well, why am I going to cover a medication for a disorder that doesn't exist? Binge eating disorder has only been in the DSM for a handful of years. That may be shocking to people because we all think of, well, anorexia and bulimia, those are the eating disorders. But now that it is in the DSM and it is an ICD-10 code, there are medications and interventions like TMS that can now be indicated for it, so now insurance will cover it. But in terms of my personal opinion, I think any time a person is proactively engaging in their own recovery, regardless of what the research may or may not say, if your son gets up every day and does the infrared sauna, is getting his TMS, he's proactively engaging in his own recovery, and that's a good thing.
5 days a week of TMS.
Yeah, and the TMS will be daily for 36 sessions approximately.
Yeah. 10 minutes.
And what is he finding?
Oh, wait. Sorry.
What is his felt
It's very
experience?
early, right?
Okay.
But the feedback from this psychiatrist initially was like, James wants to do this, but we were hoping, of course, and he would engage and be
Yeah.
cool with it. And he wants to do it, and we talk about it. He wants to continue to heal,
Yeah, yeah,
and he
He's
thinks
got-
he thinks this can.
yeah,
He's hopeful.
Yeah.
Mom and dad have been research, and we're
Yeah.
providing.
Yeah.
and he's hopeful that this is going to help. He knows he's healing on the clozapine. He has the
Yes.
insight now.
yes.
He described his brain as mush last summer,
Yeah.
and it's not mush.
Mush
now.
anymore.
So anything that can continue my healing is
Yes.
good.
Yeah,
So I don't know what more he knows right now, but
it doesn't matter.
Laurel, and then I'll come back to you.
One connection. So when you talked about weight training, I have to say, when my son got arrested, that of course, like all of us, with all the trauma we went through, I went through a deep depression, and I started weight training classes, which I've worked out, but not weight training or anything like that. And
Yeah.
that really saved me and got
Yeah.
me to the other side. And I go like 4 times a week because
Yeah.
that's my therapy. But the other part of it is that my son, while he's in jail right now, he's working out. So it really gives us a common thing
Yes.
to talk about all the time.
Yes.
So if anybody here needs something to help them, try to find a class or a group to go to, because that really helps yourself.
Yeah. I so appreciate you mentioning that, because I try to, although I have had these experiences with my 2 children, in order for this to be relevant for you, I want to really, stay focused on the science and the blah, blah, blah. But I will tell you that although I had a wonderful therapist and a very supportive spouse, that when both of my children were really struggling, and it went downhill very fast. I mean, they just went from experimenting to stealing and doing all sorts of illegal things very quickly. They'll be thrilled that this is being videotaped. My sanctuary was that same gentleman that works with our clients 5 a.m. every morning. My husband and I were standing in front of him saying, I don't know my own name right now, but Steve Rodriguez, figure me out. And he would say, we're going to go do those things that make you feel better. And that worked for me. Obviously, that wouldn't, for someone else, it would be hiking with girlfriends or whatever, but I really appreciate you mentioning that. Right? Right? Yeah.
Is there a timeline for when EEG is appropriate?
There is. Well, yes.
Well, I know that there's a mapping that's usually done.
Well, that's the EEG that I mentioned before.
Okay.
The brain mapping is the EEG that I mentioned, that with other vendors of neurotherapy, you have to get the EEG brain mapping first. And that informs what neurofeedback protocols are going to do. We don't do the mapping.
Okay.
So we do a symptom-based evaluation. But I think you also had the question about when in someone's care can they begin getting neurofeedback. Day one.
They can't do it in
Day
say,
one.
They could
Day
do
one.
like a florid psychosis.
Correct. If they're, and I'll get to this in a couple of future slides, if they are medication compliant. So they're probably not in florid psychosis. If they've been, by the time folks get to us, they've often been on medication for at least 10 to 12 days, because they typically come to us directly from the hospital. Yeah. Did I answer your question?
Yeah.
Yeah.
It sounds like it's appropriate when there's more residual.
Well, I would say a bit before, a little bit more dramatic than residual. Our folks are still really suffering when they get to us, but they're able to let us put the sensors on their scalp, which in and of itself, of course, can be terrifying. Now they're really reading my thoughts, So we have to approach that in a very gentle, sensitive way.
So it sounds like, unlike TMS, where typically you need to wait.
Exactly.
Yeah.
Yes, exactly. You do. Again, I'm not an expert by any stretch of the imagination in TMS. And my fundamental understanding is that you really have to be quite stable in order to be able to begin that. I mentioned a wonderful facility that is, again, I have no relationship to it. I just admire what they do. That's in Carlsbad. And they do TMS as part of their treatment plan. And they just do a great job. They do a really good job there, and it's in Carlsbad. It's called Crown View. Sure.
Do you want to?
Oh, I just want to talk to you offline. I guess,
Offline.
Crown View.
Okay.
And if there's any other parents whose son was at or daughter was at Crown View,
Got
it'd
it.
be interesting.
Yeah, absolutely. No, I invite the conversation. So, ta-da! Here we are. So, I always want to say the most important thing, maybe not the most important thing, but one of the most important ingredients. I don't often see people get well and stay well if their entire family isn't supported, and I really do mean their entire family. So at lots of facilities, when you go for family day or family therapy, it's not family therapy. It's a large group of families getting education, which is wonderful, but it's not family therapy with that family. And so partly because that's, as much as I am concerned about cost effectiveness for families, it's not cost effective to have a licensed psychologist do an hour a week or 2 hours a week of family therapy, but it's critical. It's a non-negotiable as far as I'm concerned. So we don't put 15 families in a room together and educate them about cannabis-induced psychosis in our treatment facility. We do what I consider as proper family therapy. It's not too common. I hope as time goes on, I hope I'm wrong. I want people to say, oh, well, my son was here and we did get family therapy. We did get proper family therapy. So feel free to chime in if you did have that. We consider it a non-negotiable, not only to teach the family model of addiction at its most fundamental and the trauma and the impact that we all experience, but also to address the trauma directly and to educate the client, the identified patient, with the fact that their parents are traumatized. And that, I'll never forget when my older one came home from 12 or 13 months of treatment, they said, "Where's my van? Where's the car?" And I said, "Oh, honey, that got sold about 24 hours after you went to treatment." And they were like, "Oh, is that like part of your not enabling me thing?" And I said, no. You were driving intoxicated and psychotic with minors in the vehicle through the canyons in a vehicle registered to Awakenings. No, that wasn't me not enabling you. That was my part of my trauma treatment. Because every time I would walk outside and see the van there, I would begin to hyperventilate. And it very quickly occurred to me, I need to sell this freaking vehicle. I did all the other things, but no, this wasn't for you. It was for me. And Elliot said, "Oh, good job, Mom." Yeah, I said, there were many other things. There still isn't a door on your bedroom. That's not for you. It has nothing to do with trust. It has to do with, I need eyes on, because you were floridly psychotic. I needed eyes on. And so it's not for you. It's not punitive, and it's not enabling or not enabling. It's for my well-being. I am focused on my well-being and your father's well-being, and yours. But you got 12, 13 months of treatment at a remarkable facility for adolescents. We didn't. We were working.
Can I just say you're a good mama?
Oh, thank you. Thank you. I was not feeling so good for a very long time. Which reminds me, maybe toward the end and I am horrible with time, so someone's going to have to give me a time check because my watch died. Because I always go over, but I won't be going over here today.
Okay, yes, you have 23 more minutes.
Perfect, thank you. Before we end or when we're done, there's a free resource that, again, has nothing to do with Awakenings, but is free it's for loved ones of. The therapist's name is Kimberly Wick. I cannot say enough about her. Her Instagram handle is help. I'm going to get this wrong. I think it's Help for Family Addiction. But the first and third Tuesday of every month, she has a free support group that is international. She's been doing it for about 15 years. And you can just connect with her. She'll send you the link, and you will have 2 90-minute family-focused sessions a month. So lots and lots of resources, and we would have to take all day if I told you about all of the no-cost support services that are available for us. So her name is Kimberly Wick, W-I-C-K. She's an LMFT. She's been licensed for over 20 years, and she's a gem of a human being. And she is in practice with her 2 daughters who are recovering. And so Lyle Wick, her older child, does the support group with her. And they're remarkable. There's a question back here. If we help with, thank you. Help with family addiction. Thank you. I can't say enough about her. So medication compliance. There's 2 things that if you didn't hear anything else I said, it's not fancy. 2 things that have to happen for our kids to get well. They have to be medication compliant, and they have to abstain from using marijuana. And sometimes we get to the end of this conversation and I think, oh my God, Corbitt, you did it again. You forgot to talk about abstinence, because how many of our children want to smoke like a gentleman, want to drink like a gentleman, want to do whatever they want to do. They can do whatever they're going to do. We don't have a lot of control over that, but they're not going to get well if they do it. So medication compliance and abstinence. And those are the only two things you heard me say, with all the other bells and whistles that I'm so excited to educate families and clients about. We're not going to get very far if we don't do that. Now, does it mean medication for the rest of your life? Who knows? There will be science a year from now, 5 years from now, that we can't even contemplate right now, that may take medication off the table. I am not aware of it just yet. And if any of you are aware of something that takes medication off the table, I want to hear about it before I walk out of this room. Any questions about this? I don't need to spend a whole lot of time. Also, I'm a psychologist. I'm not a psychiatrist. So I don't spend a lot of time talking about medication because it's outside of my scope and it wouldn't be appropriate. But like I said earlier, all of our folks are benefiting from the benefits of antipsychotics and various augmenters that, of course, can be helpful. I think we have a question over here.
Coming.
I think you just said, or when you say medication compliant, are you talking about antipsychotic
Yes.
medication? Yeah.
Yes, and whatever other augmenters that may be helpful.
Yeah.
So having a long-standing relationship with a psychopharmacologist who really knows you or your loved one, whoever it may be, and has really thoughtfully and slowly across time figured out what's most effective.
Yeah. So our son has severe social anxiety. We've also wondered if he's high functioning on the autism spectrum.
Yeah.
We've also started looking into neurofeedback.
Oh, okay, wonderful.
But so far he does IFS therapy, but he hasn't been willing to try anything else. And so he just isolates. And it sounds similar to...
Does he have psychosis?
He never was diagnosed with CIP.
Okay.
He had some delusional thinking, but never kind of lost touch with reality.
Okay.
And
that's why he's able to do IFS. I just got real concerned because we don't do IFS with folks when they have psychosis.
Yeah. Okay. Anyway, I guess I'm just wondering, some of how you described Elliot sounds like some of his symptoms.
Yes.
And I'm wondering if you think neurofeedback could be he doesn't want to, I forgot to say, he doesn't want to take we can't get him to take anti-anxiety medication or anything so far. So he's just unmedicated.
Completely unmedicated.
Socially isolating. So it's really affecting his ability to function in life.
How old is your son?
22.
Okay.
And he's been sober for 16 months.
Oh, wow. Okay. That's remarkable.
So I was wondering if you think something like neurofeedback could actually help with this anxiety without being on an anti-anxiety medication.
Absolutely. Because it sounds like his presentation is a little bit different than some of the other parents that are here. And again, neurofeedback is a frontline FDA-approved treatment for everything from the most mild ADHD or ADD all the way through to folks on the spectrum who are quite impaired and who often, thank goodness, have a love for it because it's so scientific and they don't have to talk. And they just love it, especially young men. I don't know what it is, but I noticed this very quickly in my neurofeedback career, that young men who were pretty significantly impaired on the spectrum, which always comes with profound anxiety, love neurofeedback because they don't have to talk and it's science. And something about that just seems palatable. Did I answer your question?
Yes, thank you.
And on that site that I mentioned, the brainpaint.com site, there's a whole list of providers all over the country and actually the world. So you can connect with someone in your area.
Okay. Yeah. I got one. So our son, has bipolar schizoaffective disorder as a result of his cannabis-induced psychosis.
Yes.
He's doing great though,
Uh-huh.
right? But the two things I just visited for Father's Day, the two things I notice are still moodiness, and socialization. What I mean by that is engaging in the kind of conversation you and I can have.
Sure.
That kind of thing. And maybe, so let's just say that. Is neurofeedback good for people? Have you treated people with bipolar, schizoaffective with that? And is it effective on those types of things?
It is. What I love about having been so obsessively focused on a particular modality is that I can tell you what it is effective for and what it is not effective for, because I can start sounding like a snake oil salesperson. That's why I said oftentimes people understandably say, is this some weird Southern California thing? And it's not. In fact, there's a wonderful book called Symphony in the Brain, which is a very quick read, and it goes over the history of how neurofeedback was accidentally discovered at NASA. It's sort of a bit of a gruesome thing that I won't be talking about here. It involves animal experimentation, but it's a very quick read, and there's a chapter on addressing mood disorders, addiction, dual diagnosis. It's a very easy, quick read. Symphony in the Brain.
He used to be super communicative,
Yeah.
really charismatic,
Yeah.
no issues. And now it's like he won't, if you talk to him, he'll respond.
Yeah.
Stuff.
Yeah.
Much better than he used to be.
Sure. And he will continue to get better. You said he has 28 months?
28 months,
28
and
months?
10 months on clozapine.
On clozapine, yeah. God bless that medication. It's really a life changer. It's a life changer.
Yeah, just a quick question. So my son also is on clozapine. He has a history of being incredibly non-compliant with medication. Even he was on Abilify injectable, and he would refuse it. And over time, it just lost its effectiveness. So
Sure.
He's had many relapses. The most recent relapse landed him at Silver Hill, and I made it clear
In
Silver
Connecticut?
Yeah.
Oh.
Yeah, that's where I'm from. So I made it clear that I had one goal: to get him on clozapine. I didn't want them messing around with
Yep.
2-3 other trials of
Yep.
antipsychotics. He has same diagnosis as John's son.
Yeah.
And so we all agreed that clozapine was the next step. But the problem was he a suitable candidate for clozapine?
Mhm.
And their way of trying to convince him to go on clozapine was not successful.
Oh.
They approached it more from, well, if you want to get out of here,
Oh.
you need to be med compliant. I mean, not really in the way I'm saying it, but that was
Sure.
kind of the angle that they took. Like, we want you to move your life forward. We don't picture you living your life, in a hospital. So this is going to give you your life back. He didn't really buy into it.
Yeah.
Somebody else said to him, why not try this medication? Because it would really, really help your mom a lot if you just tried this medication.
Wow.
And it would just give her like peace of mind. And yeah. It was like the LEAP method, but not really. It was more like, if you could just try this, we could do a trial of
Well,
it.
that
and
provider
just-
engaged with your son's empathy.
Yes. Yeah. Because at that point, I
Yeah.
think he knew he needed treatment. This was the first time that he went voluntarily. And he was like, your mom, do you want her, crying like she did before when you would go off your medication?
Oh, they went.
Oh yeah.
They went.
Yeah. And
hard.
it worked.
Yeah.
Now he did end up
Yeah.
cheeking it, but he's back on it now. So
Wonderful.
yeah. So
We had to get that dissolved.
yes,
Yeah.
that's what he's on.
Yeah.
Okay, we have like 12 more minutes.
Do you use the LEAP method for people that don't have insight?
You use the LEAP method
we
for
have-
people who don't have insight.
We have 2 providers that, but we embrace the model. Yeah, we embrace the model. Let me say just a quick word about the critical importance of case management. Again, this is an area that, a lot of treatment centers get so busy making sure they've got the psychiatrist and the nurse practitioner and the license this and the license that they forget our job. The time at any treatment center, even if they stay a year, is a blip in time. What matters the most is there a sustainable plan for after this place, sustainable for the whole family? And so, as obsessed as I am with all the other things I've talked about, we are so hyper-focused on making sure that wherever that person is going home to, because although we are an 8-hour-a-day program, a lot of our folks come from out of town. So we have to make sure they have a plan and a team in their hometown. And so we spend a lot of time. I could chapter and verse on the brain pain resources all over the country. I found someone in Athens, Greece for a client. It wasn't brain paint, but it was another vendor. And so we just really, really heavily focus on this, because we're not going to treat someone and then just say, wow, you did great in treatment. That's why I get so upset when I hear about things like, if you take this medicine, you can get out of here.
Yeah, because it doesn't help.
Well, it has nothing to do with wrapping that person with the relevant services for a sustainable period of time. So we don't need to take a lot of time on that. So a lot of people have a lot of feelings about 12-step fellowships. I'm currently working with a young woman who was raised in a cult. And let me tell you, she rescued herself from that cult. She went through a whole deprogramming process. And let me tell you, she is not excited to go to a 12-step meeting. She's like, they hold hands and chant. I said, no, there's no chanting. And she said, yeah, there's chanting. And I said, I will go to the meeting with you. It was a Marijuana Anonymous meeting. And I thought, oh, this is what she meant by chanting. It kind of is chanting. It's not really, but they're saying a prayer together that feels like a Judeo-Christian prayer. Okay, I got it. And I said, honey, they don't want your money. And she said, I don't believe you. And I said, they really don't want your money. You can put $1 in the basket if you want, but we're going to go to this meeting for a year. And I'm telling you, don't put $1 in the basket. And she said, maybe it's not a cult. Maybe it's not a cult. So I know that's one extreme example, very extreme example. But there's so many reasons why so many people don't want to go to 12-step. I get it. Not everyone is as in love with 12-step fellowships as I am. That having been said, for our young adult loved ones, or whatever their age may be, when they meet a bunch of other young people that are all staying clean, sober, abstinent, whatever word you want to use, together, it becomes much more palatable. It's also a social activity. So my husband and I joke about not my older one, because you can get well a lot of different ways, right? My older one, when they got out of treatment, they said, Mom, if you want me to go to those freaking 12-step meetings, I'll go. I'll do whatever you want me to do. Very compliant child, not like the little one. But I don't have any understanding of what they're talking about. Now, this is a very smart kid. So I was like, what do you mean you don't understand? This is the kid on the spectrum. No metaphorical language. No, super smart. But doesn't get metaphorical language. Turn it over. What are they turning over? I don't get it. Didn't get it, didn't want to get it, and has 5 years clean and sober. So that kid, no 12-step. But the little one, my husband and I joke now, has sponsored more people at the age of 18, just 19, than he and I have ever sponsored collectively. She does H&I at adolescent centers, blah, blah, blah. And she'll say to me, Mom, if Elliot doesn't work the steps, she's going to die. And I said, okay, honey, go to your next meeting. So that having been said, especially for those of you whose loved ones are under the age of 30, 35, these fellowships can be life-changing, but one may not feel good. And so MA may not resonate. But someone may just say, you know what, just give me garden variety AA, just give me the regular folks, and maybe that feels better. Dual Diagnosis Anonymous is a wonderful, wonderful fellowship, and a lot of young adults really enjoy that. But the challenge is, I'm from Southern California, so I have 10 DDA meetings, down the street from me a week. If you're from Nebraska, I'm not gonna have our case manager set up for you going home to Lincoln, Nebraska. We're not going to have you going to Dual Diagnosis Anonymous because you're not going to be able to go to meetings when you get home. But for folks that are really in an entrenched psychotic process, there is what was a 6-step program called Schizophrenics Anonymous, which has now changed the name to the Schizophrenia Alliance. It's a wonderful fellowship, and they have in-person, and all of these fellowships now have lots and lots of online meetings. So I can't say enough about these. Again, I know because I've been told that there are lots of different feelings, good, bad, ugly, and indifferent, about 12-step fellowship attendance. We are big proponents of this. We also love smart recovery. We love refuge. But if you're not in a major metropolitan area, your access to those activities is going to be somewhat limited. And to the degree that we can, we like to get people in a room live together. And we connect with all, which by the way is over 150, I think at this point, different 12-step fellowships. True story. Thank you. So any questions that I didn't answer?
We still have like 5 minutes. So
That is a miracle in my life.
How long is your program or any neurofeedback program?
Gotcha. So we are what, and you're all probably familiar with this, called the PHP program. So we're licensed by the state of California. We're 8 hours a day, 5 days a week. And then, we're in network with every single commercial payer. Most folks never give us a dime. They give us their insurance card. And because they've needed so much help elsewhere, their deductible is even usually taken care of. But to answer your question, we like to say that we're a minimum of 30 days, but I don't think someone has stayed for 30 days at Awakenings in years. Most of our folks stay for anywhere from 3 to 6 months, because insurance will typically cover, when you have a diagnosis that's in any of the arenas of anything we've talked about today, will typically cover anywhere between 8 to 12 weeks of PHP and then drop them down to IOP, which is legally 3 hours a day. Ours is 4.5 hours a day. Now, in terms of the neurofeedback specifically, which is just 45 minutes a day out of that 8-hour day, the gold standard is approximately 45 sessions. And of all the research that has been done on neurotherapy, no one can really tell us why that tends to be the gold standard. Now, if there is mood lability and more of a bipolar diagnosis, an additional 15 to 20 sessions can be very helpful. Yeah. Yes.
So I've got 20 years being active in AA, but what I want to understand is, what is it that, along with the neural feedback, why is it, so that I can tell a few of my sponsees, why is it that what's the best part about the AA program, other than, the support of each other?
What is the best part?
Yeah, it's like, is there certain steps, or is there a certain part of it that you think complements a lot of the other work being done?
Well,
therapists.
Well, I think in general, I like to say, not any disrespect to the spiritual component, but I think that in any 12-step program, you're getting hardcore CBT with a spiritual fellowship. And so I think for many people, it brings them a relationship with themselves and a sense of spirituality. Now, again, if someone's dealing with psychosis, that might be much further down the line. But, and I think just the joy instead of the shame, if people don't know how good it feels to say, hey, I made a mistake, I need to correct that. That can be joyful if you're not mired in shame. It feels good to be accountable. And so to say, hey, I made a mistake, I need to correct that. And you're not a piece of crap, but what you did may have been pretty crappy, and you need to amend that. You need to correct that behavior and communicate how you're going to not do it again in the future. So to my mind, being able to help people and this is just sort of a maturation thing. This doesn't have to have anything to do with any type of psychopathology, but just the joy of being accountable instead of trying to like avoid accountability or obfuscate or it wasn't me, it was his fault, you know. So the joy of being accountable and the intimacy that we can have with our spouses, our loved ones, our siblings, whomever, when we can be accountable. I messed up. You know, I need to correct that. That's where I get really focused. Yeah.
Any last questions? Okay, one more.
So your program sounds amazing. Could you tell me a little bit more about the actual neurofeedback? Because I really don't understand that.
Sure.
Thank you.
So, and it's a sort of overly abstracted thing to try to talk about. So the way we do it, we ask a symptom-based evaluation questionnaire of 93 questions that are far more than the most thorough psychopharmacologist has ever asked. There's questions about head injuries. There's questions, that's another area that we do a lot of work in. There's questions, did you have bedwetting after the age of 8? All these things that are brainwave related and psychopathology related that no one ever gets asked. So we ask all those questions. The software determines what are the appropriate protocols. So if someone is, but it's not DSM driven. So it's not like, oh, that's the bipolar protocol and that's the PTSD protocol. Because what if you have PTSD and bipolar disorder? What then? Well, I can tell you what then in neurofeedback. We have to stabilize mood first. And then and then what will happen is that because it's a whole series of complex algorithms that are not putting anything into the brain, which is, it takes a lot of time for our psychotic folks to believe us. Nothing is going into the brain. The only thing that the sensors on the scalp are doing is reading the EEG and it's operant conditioning, very gently prodding the brain to do something different. So anyone in here ever get treatment for panic disorder or phobias or anything like that? ERP, does anyone know what ERP is? Exposure and response prevention. It's a horror. It's the gold standard for OCD treatment. And it is the most godforsaken, awful thing you can ever ask someone to do. So someone has a hygiene problem. Well, we're going to build a hierarchy. And at the top of that hierarchy, we're going to go touch a public toilet. And then we're going to stand there for 10 minutes before we wash our hands. Now, that's awful, right? Most of us people that are just generally have common sense wouldn't do that. So it's this terrible treatment that is effective because it helps people break the hiccup in the brain of what is OCD. But you combine neurofeedback with ERP, suddenly you're not traumatizing people while you're helping them get better. So I oftentimes use the example of dialectical behavior therapy. Clients call it death by therapy. It's so god-awful boring and it's overly intellectualized. So it doesn't tend to go from like here to here to here, which is where it needs to get if you're going to use it in your life. But if you help people come off the ceiling from where they're vibrating because they feel so uncomfortable in their skin, then they can actually learn DBT. And we, in our place, we don't do the work, read the worksheet, fill in the worksheet. We call it therapeutic improv. So we're going to have you get up out of your chair and I'm going to be your mom. You want to ask me to pay for 3 more months of sober living. We're going to do this using your DBT skills. But the reason why that is more palatable is because their nervous system has calmed, if that makes sense. So it's sensors on the scalp. Now, it depends where on the scalp. It's not like you've seen those scary caps with the 26. There are 26 placements, but there's usually 1 or 2 sensor placements and a ground on the ear. That's it. Remember, I did this with my 16-month-old baby while she sat on my lap. And it's not a cognitive learning task. That's the most important thing I can tell you. Clients always say, I want to work harder at this. I said, well, then you're going to screw it all up. It is not a cognitive learning task. It's a brain. It's learning how to ride that bike. It's learning how to play the piano. You learn how to play the piano, you have a different brain than you did before you knew how to play the piano. So in a nutshell, that's neurofeedback. But go to that Brain Paint website and you can watch a video of an actual session.
And will you be here at the break?
Yes.
Okay, ladies and gentlemen, Ms. Shari Corbitt.
Thank you.
And thank you again to Amy for that recommendation.